Ladies and gentlemen, our program will begin in 15 minutes. Ladies and gentlemen, our program will begin in 5 minutes. Ladies and gentlemen, our program is about to begin.
Hello, everyone. My name is Brandon Leonard, and I'm the Associate Director of Congressional Relations for the American Association for Cancer Research. The AACR is proud to serve as a founding organizer for the Rally for Medical Research and to stand alongside 350 partner organizations with one united message that we must ask Congress to increase funding for the National Institutes of Health. I want to thank each of the partner organizations for their support and everything that they do to make the rally a success. I would also like to say a special thank you to the 30+ organizations that are supporting the rally financially. This event would not be possible without your support. To find the full list of rally partner and sponsor organizations, please visit rallyformedicalresearch.org. On today's training, my colleagues and I are going to be sharing some information with you to help you prepare for your meetings next week. I will begin with an overview of the rally. Then I will turn it over to Mary Jo to speak about an update from Capitol Hill. Megan Gordon-Don will then be providing information to prepare you for your meetings in terms of the messaging. And then Christopher Cush will round out our presentations by talking about logistics. If you have any questions during this webinar, please feel free to submit them using the Q&A tool at the bottom of your toolbar in Zoom. We'll leave some time for Q&A at the end of the presentation. So what is the purpose of the rally and the mission of the rally? Many of you may know, because you've participated in the past, the rally actually started in 2013. And the goal of the rally is to mobilize a broad coalition of groups across the medical research advocacy community, all urging Congress to invest in the NIH to improve health, spur more progress, inspire more hope, and save more lives. We've had incredible participation in the Rally for Medical Research since that first event back in 2013. Including this year, we will have more than 350 partner organizations involved, over 2,000 total participants, representing all 50 states, DC, and Puerto Rico, more than 1,300 total meetings, and millions of social media impressions. For this year's event in particular, we have approximately 500 advocates, making this by far the largest rally ever. We have all 50 states plus DC and Puerto Rico represented, and we'll have over 300 meetings with House and Senate offices, and many of those will be directly with a member of Congress. Here's a quick overview of the upcoming events for the rally. First of all, we invite you all to attend a virtual reception on Wednesday, September 16th, beginning at 5:30 Eastern. That will be held via Zoom webinar. You can register at the rallyformedicalresearch.org website. And we certainly want everyone who's participating in the rally to join us. This is also open to the public, so if you have friends, family, colleagues who would also like to join and they're not participating in the Hill Day, please feel free to share the invitation with them as well. We have some great speakers, including NIH leadership, members of Congress, and advocates who will be featured, so please join us. The Rally for Medical Research Virtual Hill Day, of course, will take place next Thursday, September 17th. That will be all day from 9:30 to 5:30 Eastern Time is when your meetings will generally be scheduled. Later on, Christopher is going to provide some more information about the scheduling process. I wanted to briefly share a few resources that you can find on the Rally for Medical Research website, and also to let you know about some things that you can use in your communications. So even outside of the virtual meetings that you'll have on Thursday, There are other opportunities for you to share the message about the importance of investing in medical research. We have a toolkit page on the Rally for Medical Research website. It includes a grassroots toolkit for your organizations to use if they'd like to reach out to your grassroots advocates and encourage them to send messages to members of Congress. We also have an NIH Leave Behind flyer. So that's a document that is going to be sent to every office that you'll meet with, but you'll have it for your reference as well. We have a document that shows our rally message. We have an iRally4 template that you can print out and use to put the reason that you're rallying and put and post pictures with it. And then our social media outreach, I just wanted to let you know, if you haven't already checked these out, be sure to take a look at the Rally Facebook page, note our Rally Twitter handle, and then we have 2 hashtags. The primary one is hashtag RallyMedRes, and our secondary hashtag is hashtag FundNIH. I also wanted to mention the Rally Hill Day National Day of Action. So this is something that we actually do every year for the rally, and it gives people an opportunity to participate even if they can't be a part of the virtual meetings. So you are welcome to do this as participants and also to encourage others to do this as well. We'll have a sample action alert up on the Rally website next week that you can use to send an email to your members of Congress, and you can also have resources if you want to send social media messages as well. So that concludes my slides. I'm now pleased to turn it over to my colleague, Mary Jo Hoeksema. Mary Jo is Director of Government Affairs for the Population Association of America and the Association of Population Centers. And Mary Jo has very graciously for many years provided an update on what's happening on Capitol Hill for our rally training. She's offered to do that again this year. So Mary Jo, thank you very much, and you can take it away.
Thank you, and thank you, Brandon, and thanks to everyone for taking time to prepare for what promises to be another inspiring and successful Rally for Medical Research Day. As Brandon said, my primary role today is to give you some brief background information so that you're aware of 2 things, the current environment on Capitol Hill and the state of play with respect to funding for the NIH, both as part of the fiscal year 2021 appropriations process and as part of the current COVID relief deliberations. First, a few words about the environment in which this year's rally is occurring. There's several reasons why tensions are running high on Capitol Hill currently. Negotiations on the next COVID relief measure at a standstill. Fiscal year 2021 appropriations are unresolved. The nation is reeling from the pandemic. And of course, all of this is happening against the backdrop of a very consequential upcoming presidential and general election in which members of Congress are eager to get home and campaign before the beginning of October. Now, on a positive note, support for NIH garners broad bipartisan support. And the message that the Rally for Medical Research delivers is always, I feel, positively received. And I suspect the same will be true this year, despite the stress of these difficult and unprecedented times. Next slide. So hopefully you're seeing a slide that gives you a little bit of funding history about the NIH. And this slide illustrates well how receptive Congress has been to our past expressions of support for the NIH. For 5 straight years, NIH has received at least $2 billion increases annually. Next slide. In fact, since fiscal year 2015, Congress has increased the NIH budget by $11.6 billion, which is a 39% increase over that period of time. Now, these funding increases are attributable in part to the high-level bipartisan support that the agency has received from influential members of the House and Senate Appropriations Committee, especially the leaders of the House and Senate Labor, Health and Human Services, and Education Appropriations Subcommittee. Those members are Congresswoman Rosa DeLauro, Congressman Tom Cole, Senators Roy Blunt, and Patty Murray. Now, these champions count on hearing from stakeholders regularly about why the NIH needs robust, sustained, and predictable increases. We as NIH advocates cannot afford to diminish our efforts and must continue to communicate to our champions, as well as to all the members of Congress, about why annual funding increases for the NIH are needed to address existing scientific opportunities as well as challenges. Next slide. So you're advocating for increasing NIH in fiscal year 2021 at a critical point in the debate. On July 31st, the House passed a package of appropriations bills that included an increase of $500 million in annual appropriations for the NIH and $5 billion in emergency funding for NIH in response to the COVID-19 pandemic. Now, the Senate has not yet considered any of its fiscal year 2021 appropriations bills, and those of us who follow the appropriations news do not expect even draft Senate appropriations bills will be unveiled before mid to late October. So this means that our message of support for funding the NIH is still very relevant to the discussions that Congress is having and about how to resolve the final fiscal year 2021 appropriations measures. Next slide. Now, as many of you may know, fiscal year 2021 begins October 1st, which is less than a month away. Given the unlikelihood of Congress passing and the President signing into law any of the fiscal year 2021 appropriations bills before then, Congress and the administration will need to agree on the terms of a continuing resolution. You're going to hear that abbreviated a lot during your meetings probably next week. Staff refer to it as a CR. And that CR is necessary in order to keep the federal government funded and open. Press accounts suggest that Speaker Pelosi and Treasury Secretary Mnuchin, who are leading the current CR negotiations, are close to reaching a deal on a clean CR, free of controversial policy riders or dramatic fluctuations in funding for any programs or agencies. Negotiations are really centered right now around the length of that CR. How long should it last? Should it expire in mid-December, next February? Both sides right now are really gauging the potential outcome of the November election before deciding on the length of the CR. For NIH stakeholders, it's important to express support for a CR to prevent a government shutdown and sustain ongoing research. However, it's also important for policymakers to hear how disruptive CRs, especially if they continue into the next calendar year, can be for scientific research. If you have examples from your experience about the disruptions that previous CRs have created for you, your colleagues, your patients, your students, you should feel free to share those during your meetings next week if there's an appropriate opportunity to do so and in consultation with your group leaders. Another point you or your group leader may have the chance to acknowledge is how restrictive fiscal year 2021 federal budget caps are and how they may affect the ability of NIH to receive substantially more funding in the next year. This is a reality of the current budget environment that could be addressed if Congress and the administration would agree to adjust the existing budget caps or provide targeted funding exemptions for agencies such as the NIH. Next slide. In addition to fiscal year 2021, Congress is debating the merits of giving NIH additional funding as part of the next COVID relief measure. NIH has received supplemental funding in 3 of the emergency packages that have already been approved earlier this year. And this funding was specifically designated for research for NIH to conduct related to COVID. On May 15th, the House passed the HEROES Act, a supplemental package that included $4.75 billion in funding for the NIH. This bill was not considered in the Senate and won't be. Now, on July 28th, the Senate Majority Leader, Mitch McConnell, introduced the HEALS Act, which included $15.5 billion for NIH. This package has not been voted on in the Senate, and in fact, today, the Senate is considering another stripped-down version of the HEALS Act, but likewise, it is not expected to pass. Now, hopes are high that Congress and the administration will eventually agree to the terms of another comprehensive COVID relief measure before the end of the year. And if they do, NIH stakeholders support providing the agency with supplemental funding once again. Next slide. So to recap some of the key items from this state of play, 3 things. Negotiations on the next emergency COVID relief package involving House and Senate leadership and administration officials have reached an impasse, but will continue. The House Speaker and the Treasury Secretary have reportedly agreed in principle to a CR, or continuing resolution, that would extend funding at fiscal year 2020 levels beyond October 1st to avoid a government shutdown. And 3, there is a possibility Congress may also take action to adjust the budget caps for fiscal year 2021 or make exceptions so that agencies such as the NIH can be increased. Next slide. So as I said earlier, this year's Rally for Medical Research is occurring at a pivotal time. Funding decisions are being made now for fiscal year 2021. Terms of a continuing resolution are being negotiated, and debate on the next supplemental COVID relief package is ongoing. And you have an opportunity to ensure that the NIH emerges as a major spending priorities in all of these matters. You should feel reassured that despite these tense, uncertain times on Capitol Hill, the rally's message of support for NIH and medical research will be universally well received. The Rally for Medical Research Virtual Hill Day will be an important opportunity for the NIH advocacy community to underscore the need for increased funding for the agency. Thank you for your attention and once again for participating in this year's rally.
Thank you, Mary Jo, for that great presentation. And Megan is another leader who has been outstanding in guiding our rally trainings in the past. And so we're so excited to have her back again this year. Megan's the president and CEO of MGD Strategies. So take it away, Megan.
Thank you. Hello, everybody. Bear with me a second while I share my screen. Let's see if this is going to work. So congratulations. Every one of you has decided that even with this pandemic, these issues matter so much to you that you are setting aside all the other things that are going on in your life, whether it's a sick dog or kids in school or needing to make sure your kids have lunch right now, or all the other washing machine broken, all the other things that we are all dealing with in our lives, and focusing on increasing medical research funding. We know that advocacy works, and if you have been a part of the rally before, when we've been lucky enough to be here in DC, or this is your first time participating in the rally, we know that when advocates speak up and advocates take the time to meet with their members of Congress, we can have a real impact. So if you look at this chart a little more closely, I know Mary Jo had shared it as well, it's showing you that advocacy really impacts what Congress does. So in the last 5 years, there has been a 39% increase in NIH funding, and that is because of advocates like you. So thank you for taking the time to do this. We are going to walk through the messaging that we need you to deliver, and walk through some of the logistics. And by the end of this, you should have a pretty good handle on what we need you to communicate to Congress next week. But we're also going to make all the resources available to you so that you can go back to it and check it out if you need more time with it. So this crazy slide with lots of words is our official message to Congress. And don't get worried. Don't try and read it all right now. We're going to walk through some ways to make it simple and put it into smaller bites. But the other thing that I want to point out is that different from how we've done this in the past, the group leader is actually going to be delivering the ask this year. So it's a little bit different. And as a participant, you're going to have some other roles in the meeting. So some of the other tools that we have to help you through your meetings next week, we have a sign that you can get. If you look at the website on the bottom, you have a sign that you can fill out to tell members of Congress why you are participating in the rally. And we encourage you to not only hold it up during your meetings, but also use it in social media. We've got a one-pager fact sheet that talks about the NIH and the NIH's impact on medical research and on the economy, which is a critical point, particularly given what is going on right now. There is a state fact sheet where you can get more information on what's happening in your state with medical research and the impact on the economy. We have a printout of the asks, so that big wordy slide that I showed you, it is all right there. There are sample visit videos, so you can see what this is going to look like and get a feel for it before you actually participate in it. And finally, there are talking points for participants. So all those materials are available to you. So going back to our message. So the overview of it is we have a big thank you that we're going to give to every member of Congress. And then we're going to ask them to increase funding for NIH. And we have 3 separate things that we need them to do to make that happen this year. So we're going to ask Congress to increase NIH's funding for regular research. We're going to ask them to be able to do that, increase funding for regular research, by taking the NIH funding out of the caps. And we'll talk about all of this. And then we're going to also ask them for some emergency supplemental funding. So those are kind of big overview of what we're talking about. So simplified version of talking about this is thank you, 2 thank yous for every member of Congress. And then for fiscal year 2021, which is what we're focusing on right now, we have 3 separate things. 2 of them go together. So increasing NIH's funding for regular research and taking that out of the caps, those 2 things go together. And then the emergency supplemental funding is on its own. So we're going to walk through this in detail so that everyone is comfortable with it. But again, keep in mind that the group leaders are the ones who are going to deliver these asks. So in most cases, as a participant, this shouldn't need to be your focus, but we want everyone to have a good sense of what the asks are, partially so that you can be a good participant in the meeting, but also so that as you're thinking through your stories, you can help tailor them to these asks and tailor them to putting that human face on why medical research is so important. Okay, so let's look at the thank yous first. So again, 2 thank yous for every member of Congress you're meeting with. The first thank you is thank you for providing 5 years of robust funding increases for NIH. So that's going back to that slide that we showed with the chart, that 39% increase over the last 5 years. That's huge. And we want to acknowledge that Congress has made this a priority, and now we're asking them to keep making it a priority. And then secondly, recognizing that NIH has a vital role in the COVID-19 response. And that goes to all ends of it, from doing all the basic research that allows vaccines to even happen. Think about the flu vaccine. NIH has a role in that, how flu works with COVID and how we're going to have to manage both. Think about all the underlying conditions that NIH is focusing on. And then think about the development of a vaccine for COVID. And all the other things that might come, treatments and those things. NIH has a role in all of that. So then what do we want Congress to do this year? So first, just to make sure that everyone knows this, NIH stands for the National Institutes of Health. Can't see this, but it's actually about half a mile from my house that way. And it's, big campus, multiple campuses, and NIH is composed of 27 different institutes and centers. So no matter what disease you are focused on, disease or condition, NIH has a home for that. And these are just some of the these are all the institutes. And they're really focused on, they're our federal government's medical research machine. So one of the things that is so critical about NIH is that regular business, what they're focused on is developing cures and treatments and early detection tools and screening tools and all the basic research that leads into that for every disease that Americans face and diseases that are global issues. So if you think about chronic disease in this country, 60% of adults have at least one chronic disease, and 40% have 2 or more. So a lot of Americans are facing some kind of medical issue, and NIH research has either led to treatments and other tools for those diseases, or they're working on it. So that's NIH in a nutshell. That's their regular business. That's what they focus on. But then those diseases at the bottom, those are some of the leading causes of death and disability in this country. And that has a huge impact on what we have to spend as a country on annual healthcare costs. And so if we had better disease management for those things and better tools, we could bring those costs down. So NIH has a huge role in all aspects of our lives. So our first ask to Congress is that they provide the NIH with at least $44.7 billion, which is a $3 billion increase to the base budget for fiscal year 2021. So here's a way to think about that. We'll go through a couple different ways. So this is the chart that we showed you earlier. So again, the NIH's base budget is what they do for regular research. It's kind of their regular business, dealing with all those diseases at the bottom and every disease that's represented by a participant on the call and participating in the rally today. So that's what base budget is. And then if the $3 billion is the difference between what we want for fiscal year 20 and fiscal year 2021. So we want a $3 billion increase to that. So hopefully that makes sense to everyone. But then thinking through kind of some of the other asks and how they all play together. So we know that heart disease in particular and many other lung disease, other underlying conditions are going to make the impact of COVID worse. And it's going to increase COVID deaths, and that's a real issue. And when you look at the slide, keep in mind this just was until May. So it's very small set of data. So this is important for two reasons when we're talking about this year and what we need for NIH funding. First, it's that all those underlying conditions are making the problem of COVID worse. And second of all, that at some point, and I know everyone, we're all hoping that some point is very soon, but at some point, we will have ways to manage COVID. But these other diseases are still going to be there. And so we have to figure out a way to deal with all of these diseases, and that's why NIH funding is so important. And that's why we need that $3 billion increase to deal with all the diseases. So then looking at it a different way, and the other impact that COVID has. So as we said, we know that the underlying conditions increase COVID deaths and complications. But we also, the direct impact of COVID on our nation's research enterprise has been huge. And Dr. Francis Collins, who's the director of the National Institutes of Health, has actually testified to Congress a couple of times and has been in some other media sources talking about this, that the impact of COVID on the medical research enterprise is probably somewhere in the neighborhood of a $10 billion loss in terms of the cost needed to restart all of that research. So think about it, all of us had to go home from our jobs, but so did researchers. They had to close their labs. So it's not only continuing to pay researchers while they're not in their labs, but it's also a mouse that you spent a lot of time developing for your research, can't really put that on hold. Or experiments that you have going on, when you come back into your lab 6 months later, a year later, however long this takes, it's not like things have just stayed stagnant. And so in most cases, they're going to have to start over with a lot of these things. So lab research has been paused. Research resources have been diverted to the COVID effort. And clinical trials have been paused. And think about all the patients, those of you who have participated in clinical trials know how hard it is to get those trials ramped up, to meet all the requirements, to find the right patients. And then you started this big effort for this large clinical trial, and then you have to pause it because you don't have the medical professionals who are able to be there to monitor the symptoms, or patients have had to pause for any number of reasons. So that is a huge cost that it is going to take to get all of this ramped back up. So, and that's really causing a emergency in research funding. And so that's why we talk about the emergency funding that we need for COVID is for some of these reasons. So another way to think about this. So think about our asks in two separate boxes. So the first is regular NIH funding, and then the second is emergency. So in the regular NIH funding, we want a $3 billion increase, but there's this issue of a budget cap. And we're going to talk about that in a minute. And I know Mary Jo explained a little bit about that. So we need to get that $3 billion increase for regular business from under that cap and deal with it separately. And then on the other side, we've got emergency supplemental funding. And for that, we need at least $15.5 billion to make up all of those issues that we're dealing with because of COVID. And we want to do that. As Mary Jo said, there is a bill that's bouncing around in Congress right now, a couple different bills. What we're really talking about is whatever the next package is, that we want $15.5 billion for emergency supplemental funding for NIH as part of that. So let's talk a little bit about what budget caps mean. So budget caps have been around for a very long time, but when we talk about them now, what we're talking about is first a bill that was passed in 2011 called the Budget Control Act that set up funding caps for each of the fiscal years from then until fiscal year 2021, so the year that we're dealing with now. So we're in the last year of the caps. Congress has pretty much looked at the caps just about every year. And in fact, in 2019, they passed legislation called the Bipartisan Budget Act of 2019 that slightly increased the caps for the last 2 years of that 2011 deal. So we are now in the last year of the budget caps, but even with the BBA, the cap is pretty low. It doesn't allow for a lot of growth. So if you're thinking to just understand what this means, so we're focused on discretionary funding. So there's discretionary and non-discretionary or mandatory. We're focused on discretionary funding. Discretionary funding is broken into two parts, defense and non-defense. So we're focused on the non-defense side. So in the BBA, for 2021, they said that $671 billion could be used for all defense discretionary spending, and $626.5 billion could be used for all non-defense discretionary spending. So non-defense discretionary spending is a lot. All those programs there, including scientific research. So that whole increase that is allowed under the BBA for all of non-defense discretionary spending, all of those programs, is an additional $5 billion. And these were set way before COVID was an issue, way before we had any sense of what was happening on that. And we knew it was going to be low, but now the impact is even more significant. So go back to thinking we are requesting a $3 billion increase, and there's only $5 billion in that pot. So one of the things that we are asking Congress is to remove the NIH funding, given that this is such a unique year, out of that capped amount, so that we can make sure we get additional funding. We can get the additional funding we need. So going back to our message, so we're asking each member, or we're telling each member of Congress, thank you for providing 5 years of robust funding increases for the NIH, including a $2.6 billion increase last year. And thank you for recognizing NIH's critical role in the COVID-19 response. But for fiscal year 21, we are asking that Congress provide at least a $3 billion increase to NIH's base budget to deal with regular business. And we need them to exempt NIH from the highly restrictive budget caps for this year. In addition, we're asking that they provide at least $15.5 billion in emergency supplemental funding for NIH through a new COVID-19 relief package. So hopefully all of that makes sense. And again, you can find more tools to help you with it. So let's talk more about what we are asking participants to do during these meetings. So as I said, the group leader is going to do a number of things this year, a little bit different from how we've done it in the past. Your group leader is going to set up some practice calls for you, some logistic calls over the next few days, going into early next week. They're going to kick off the meeting with your member of Congress and direct the flow of the meeting. And they're the ones who are going to make the ask. The participant, you, are in charge of putting a human geographical central face on the issues. So you want to connect with your geography. If you are talking to your member of Congress, you want to make your geography very specific. So not just, I'm Megan Gordon Dunn, I live in San Antonio, Texas, but I am Megan Gordon Dunn. I live just off of Wurzbach Road, where it hits La Calzama in San Antonio, Texas. So really making sure that your member of Congress knows exactly where you are. And you're putting a face on the need for medical research. So you're doing that by sharing your story. So you really want to connect with the members of Congress that you're talking to and their staff. And remember, congressional staff are critical. They sometimes may be very young, but they are really the ones who are critical in the decision-making of whether or not the member of Congress is going to move forward. They make the recommendation to the member of Congress on whether or not to move forward or not. So you have a couple of aces up your sleeve. You're the expert on your story. I guarantee you, no matter how much your member of Congress or their staff knows, they don't know your story, the disease you're dealing with, as well as you do. So you are the expert on that. You are also a constituent, which being a constituent is critical anytime, but in 2020, facing this election, it's really critical. So members of Congress care about what you think and will want to hear you tell them what you are asking them to do. So a couple of guidelines for telling your story. First of all, don't forget to give your name. I cannot tell you how many meetings I have sat in both as Hill staffer and as a lobbyist and as a trainer, and people forget to give their names. And that's just a critical part of making that connection with the person that you're talking to. As we talked about, pinpoint your geography when it's a meeting where it's your member of Congress. And have several versions of your story ready to go. Your group leader will direct you on which type of story you should tell in each meeting. So the 4 to 5 second one is, hi, Megan Gordon Dunn, live in San Antonio, Texas. I'm here because my mom is a 2-year survivor of cancer. Short story, a little bit longer, 1 or 2 minutes, not getting into a huge amount of detail, but enough so that you're making an impact and the member of Congress or the congressional staff understands really something about the disease and why finding treatments or early detection tools are so important. And then a longer story, when your group leader really thinks that that's what's needed to, they will know a little bit about you, and you're going to talk about it on your calls of who should give a longer story in which meetings. And that's really when your story is going to help really bolster the arguments. So they'll help you figure that out. And that really, even longer stories still shouldn't be over 3 to 5 minutes, and focus on making it memorable and connecting with our asks. And also, we've sent out a link to everybody to ask you to write your stories down, and we're sharing those with members of Congress and their staff prior to your meetings. So those forms, we've extended the deadline, are due today. So we ask that you please do that. If you have time, we would really appreciate it. And it's another way to connect your story with your congressional office And in some offices, you're not going to have an opportunity to tell your story. In those big, huge Senate meetings, like California or Texas or Florida, where we have 40 people or so, everyone is not going to get to introduce themselves or share their story. So this is a way that your member of Congress and their staff can still see that you're there and have some understanding of what's important to you. So I wish I could tell you that every meeting is going to be perfect, smooth sailing, no issues ever. There's always one that is a little more difficult. And your group leader, those people are trained advocates or experienced advocates, and they can deal with the pushback in most cases. But just so everyone is aware of some of what might come up, the most likely thing that we're going to hear is probably we can't afford in this economy to provide significant increases for NIH. And we won't hear that from every member of Congress, but we'll hear it from some. And again, remember that we've had difficult economic situations before, and that NIH funding graph has gone up. And funding has gone up for lots of things. The big secret is that funding goes up for priorities. And our job next week is to make sure that Congress knows that NIH funding is our priority. So you want to tell them that NIH funding needs to continue to be a priority. It's your priority. Remind them how many people are dealing with disease in this country and how important that is for our economy. We also have to find treatments for COVID and a vaccine, and NIH has a critical role in that. And we've got to repair the damage done by COVID to our research enterprise. So the reality is we can't afford not to make NIH a priority. And so then you go into our ask. So in order to make NIH a priority, we need you to do these things. So again, you can see sample videos on the website, and there's one that we're going to show at the end of this. That's kind of the easy meeting, and then we have an example of a little more difficult meeting. Follow-up is always the chariot of genius, and someone told me that long ago, and I think I use it all the time. So it's really important that everyone who's participating follows up. So fill out the feedback form on the Soapbox mobile tool. Post on social media and use our hashtag so we can see that. And connect with the staff after your meeting to both thank them for the meeting and remind them of the ask. So remember, you're the constituent. Members of Congress work for you. You're the expert in your story. So your job is to make members of Congress remember you next week. Few final thoughts and tips. These are conference calls and video calls. So please don't forget to mute your phone when you're not talking. Respectful give and take is a good thing. This is not the time to tell your member of Congress that you didn't vote for them, will never vote for them, and can't stand them. You have an opportunity to make all of those points on election day, and that is your given right as an American citizen. But it is not something that you should be doing next week during these calls. Let's focus on our asks, because when we all speak with one voice, we can actually achieve the things we're asking for. Remember, if you can't change their minds today, leave the door open to try again. This is partially about building relationships too. And remember that your story is a potent tool in these advocacy efforts. So hopefully that helps everyone get a sense of both what we need from you as participants and what the asks are, so that you can think about how your story relates to the asks and be practicing your story in a couple different ways of telling it. And hopefully you will have a number of awesome meetings next week. And feel free to go back to all the training on the website. We're gonna, actually now I'm gonna turn it back over to Brandon, because we're gonna see a video that shows you what a visit might look like.
Good morning, everybody. I'm Congressman Johnson. How are you all? Who will be joining us today?
Hello, Congressman Johnson. Thank you for meeting with us today, agreeing to meet with us virtually. My name is Caroline Powers, and I'm from the American Cancer Society Cancer Action Network, or ACS-CAN. And the three of us are here today representing the more than 350 different organizations and more than 500 participants in this year's virtual Rally for Medical Research Hill Day. And we're here to talk to you about the need for continued robust funding for medical research. But before we get too far along into our presentation today, I wanted to go ahead and have my colleagues introduce themselves.
Hi there, Congressman. My name is Carl Welliver. I live on Spring Street in Old Town in your district.
Okay, great.
Great to be with you. It's great to be with you. I'm here today representing the research university in your district, but my father is also a patient who's benefited from medical research. So I'm here representing him today as well. Thank you for having us.
Nice to meet you, Carl.
Hi, Congressman Johnson. My name is Krista Wagner, and I live in the district just next to the one that you represent.
Okay.
I'm a researcher focused on one of the most common rare diseases, spinal muscular atrophy, and I've seen firsthand that there's a huge need for continued medical research funding. So happy to be here, and thanks for the time.
Nice to meet you, Krista.
So Representative Johnson, we'd like to start just by thanking you for being a long-term supporter of the National Institutes of Health. Yeah, we know you get it. And thanking your colleagues actually for providing 5 straight years of robust funding increases for the NIH, including just last year for fiscal year 2020, a $2.6 billion increase. And also for recognizing that NIH is playing a vital role in the COVID-19 response. We're here today because we need you to continue this momentum into fiscal year 2021. Mm-hmm. And so specifically, we'd like to ask that Congress provide the NIH with at least $44.7 billion, a $3 billion increase in fiscal year 2021. As you know, this funding is essential to support the opportunities for life-saving medical research that we have today. And finally, because we need to not only ensure that NIH has the resources necessary to forcefully respond to the COVID-19 health crisis, but also ensure that they can continue the research that's so critical to improve and save lives from all of the other diseases that Americans continue to face besides COVID. So we have 2 additional asks that I'll quickly go over. Number 1, we're asking that Congress exempt NIH from the highly restrictive fiscal year 2021 budget caps. And number 2, we're also asking that Congress provide at least $15.5 billion in emergency supplemental funding for NIH as part of the next COVID-19 package. So with that, I want to turn to my colleagues. So Carl, could you please tell the Congressman your story and share your experience and your family's experience?
Thank you, Caroline. Congressman, my dad was diagnosed with Alzheimer's disease several years back.
About that. I'm sorry to hear that.
Thank you. As you may already know, over time, my father's memory and communication skills will continue to decline. And that's if we don't have a research breakthrough. But while there are promising developments in early detection and behavioral management for other folks similar to my father, it's not going to help him. And me and my family are going to be working through that for some time here. I'm counting on researchers coming up with new treatments to help with Alzheimer's disease, and that might work for him, and to protect both my kids and me and my family as we move forward. So that's one of the things that increased advanced research funding for biomedical research could do for us. And so that's why this is so important to me and my family.
Understand.
Thank you, Carl. And obviously, Carl's story is very personal and illustrates the hope that NIH provides millions of American families and patients. So thank you so much, Carl. And now, Dr. Wagner, could you share sort of your story and some of the research you've been doing and your experience through this pandemic?
Absolutely. As I mentioned before, I lead the Spinal Muscular Atrophy, or SMA, research team at the university in your district. SMA is a devastating genetic disorder causing progressive muscle weakness and leading to premature death. We've actually been working on a new treatment for SMA over the last 5 years and have been making really great progress, and NIH grant funding has been instrumental to our research. But unfortunately, we had to close down not only our research lab, but also our clinical trials last spring because of COVID-19, and are only just now trying to restart our research. So as you probably understand, research isn't meant to be put on ice for a few months. So we've been finding that we need to restart some of our research all over again, which means a significant unexpected cost and also a delay in research progress. We're also facing unexpected complications in terms of actually performing our research now in a more socially distanced environment. So in terms of SMA, about 400 babies will be born with SMA in the United States this year, and our research could mean a real change in the quality and longevity of these children's lives. So we really want to keep up our research. For us to meet those goals, however, we need NIH to have the resources not only to continue the funding as planned, but also to help cover the unexpected costs because of COVID-19. So thanks for your time.
So thank you, Dr. Wagner, Congressman Johnson. Hopefully these stories communicate the urgency of our request. And while we greatly appreciate Congress's past bipartisan support for medical research funding, and we understand, the very real federal budgetary constraints as a result of the pandemic, we are asking that you continue to make NIH funding a priority. Specifically, we're asking for a $3 billion increase for NIH in fiscal year 21, and also ask, again, that you exclude NIH from the budget caps and provide $15.5 billion in the next emergency package so that they can use those resources to not only fund COVID research, but also continue their work on the thousands of other diseases that our country faced before the pandemic, and we are going to continue to face. So your office, before our meeting, also received a pack of constituent stories that we hope provide some other examples for you on why continued robust funding is so critical. But do you have any questions for us? I know we kind of laid it all on you, a lot of information. We're happy to answer anything.
No, I don't have any questions at the moment. I've been a steady supporter of funding for medical research, as you all know. And like many of you, like you all have told me, we have loved ones affected by cancer and diabetes and Alzheimer's. And as some of you all may know, I have epilepsy. And so I can tell you from personal experience that medical research has affected my life. And I will consult with my staff about your requests, but it's safe to say that I'll be supporting any increase for NIH funding. I wish you all well on your Hill Day. Good luck, and stay in touch with my office. You can talk to my policy advisor when you all leave the office.
Okay, well, thank you so much, Congressman. We so appreciate your time, and we'll be sure to follow up with your office. And have a great day.
Oh, thank you. Thank you.
Hello again, everyone. Well, I first of all wanted to thank Megan for that excellent presentation and all the helpful information that she shared. I also wanted to thank my colleagues Caroline, Carl, and Krista, and of course my friend, the distinguished gentleman from Virginia, Mark Johnson, for contributing that excellent mock meeting video for you all to view. I did want to note that they are not up there today, but soon we will be posting that mock meeting video, as well as a second one that features some pushback for Congressman Johnson makes it a little bit harder on the advocates, so you can get two good examples as well as a recording for the entire training that we're showing today. Now it's my pleasure to turn it over to Christopher Cush, who is the CEO of Soapbox Consulting. Soapbox has helped us with the rally scheduling and logistics for many years, and they do an amazing job. So Christopher, I'll turn it over to you.
Thank you very much. And thank you, everybody who's going to help bring this message to Capitol Hill next week. We appreciate it. I will let you know that congressional offices have been quick to adjust to this new world. So many of your meetings will be with members of Congress. They might be conference calls. So there'll be a mix of webinars and conference calls. But business is getting done, and issues are moving forward even in the COVID time. So your time is really well spent helping Congress do the work of this nation, even with some of the other challenges that it's facing. In terms of what we are going to do, I think Brandon mentioned that we've got all 50 states covered. We've got about 500 advocates that are going to be telling their stories, 340 meetings with members of Congress. Many of those will be happening at the same time, so it's a tightly orchestrated event. We've done everything we can to make it smooth and reliable for you, and I'll go through some of those aspects of the event to put you at ease before you have your first meeting. You'll see on this map that there are red dots and blue dots. Remember, no matter what their party, the people who represent you now will represent you until after the election. So if you're not a supporter, maybe you just don't bring it up, but they will represent you in your district, and there's no reason to assume that they don't. By now, everybody should have received an individual code for the Soapbox mobile tool. This code is for you only. It allows you to see your individual schedule. There will be changes before next week. So this mobile tool allows you to see your meetings in real time. There's also a few additional things that are built in there. If you haven't explored it yet, I want to bring your attention to some of those things. In the middle of this screen, you see the panel where we ask for your cell phone number. You can use the mobile tool on a desktop. You can use it on a laptop. So all of that is fine. We will send you on your phone a reminder for each and every meeting 1 hour before it begins. So please note, if you are in a different time zone, that all of the meeting times listed on your mobile tool are in Eastern time, but you'll receive a text message, a push notification 1 hour before each meeting to try and keep you on track. On the right-hand side of this screen, you see a couple of those buttons I just wanted to draw your attention to. One is where you can find your schedule in the upper left. In the upper right, where you can see the other folks who will have the same schedule as you, which will be your 2 Senate meetings, your House meeting, maybe another House meeting or 2 from your state. Right in the middle there will be where you can find documents, so you can see issue briefs and talking points. In the bottom center, you see the Soapbox Help Desk. So on the day of the event, you will be receiving live help. Also during your practice sessions, you'll have live help, and we encourage you to reach out and call us if you need any assistance. And finally, in the bottom right, just up 1 row, is Soapbox Story Bank. So many people have filled out Soapbox Story Bank at this point. It results in a very nice 1-page document that we can use to brief the offices you are going to meet with, and these will go to the offices in your state before your event. It's also a way that we can follow up with these offices and remember your story and keep communicating it through a long and sometimes complicated process. So please press that story bank, share with us what brought you to this rally. On the upper right-hand corner, you can press your team to see the folks who you are going to be having all of your meetings with. Kevin, I need you to be, that's not going to work. Okay. So I have a competing audio here. You'll see in the bottom half, it'll list all the names with emails of your folks that are going to be on the same meetings as you. And you will notice here that it'll be noted if somebody is a team leader. So now that team leader is going to reach out to you and ask if you can all get together as a team either Friday from 1 to 5 p.m. Eastern Time or next Wednesday from 1 to 5 p.m. Eastern Time. And that'll give an opportunity for you to test the GoToMeeting platform, for you to make sure your camera and your phone work, for you to meet the other folks that you are going to be going or having all your meetings with, and prepare your stories, prepare to dovetail that into our requests. The Soapbox Help Desk is going to be live during this time. So that phone number is below here, but it's also a button on your mobile tool. Please feel free to use it if you're having trouble connecting to your practice meeting. Your practice space will be in the same space as your first house meeting. So if you look at your schedule, and I have a copy on the left of an example schedule, there will be a hyperlink at the end of each and every meeting. If you go to your first house meeting, that's going to be the space where you meet the rest of your team. For those of you in Team 1 for any state, it's the same as your Senate meeting places. We attempted to keep that link the very same for all of your house meetings. And so once you get into this space to practice, you probably are going to have the very exact same link for all of your meetings. So please take note of that. It gets easier. We just need to get your phone, your video and your audio hooked up during that practice session, and then you should be able to roll through your day. You have your feedback form on the right. Remember, every single meeting will need some feedback, and you can even attach a photo. Please no live video. So we have an election coming up. It is explosive if they catch somebody videotaping a meeting, or they see online somewhere a snippet of video from one of these meetings. So you are not allowed to videotape these meetings. Please don't do it. However, if you ask for a still photo of your screen and that Brady Bunch look, that's all good. So please do that. And if you get one, attach it to your feedback form. This is what GoToMeeting looks like. That is the platform that every single one of our meetings will be in. Whether it is a conference call or a webinar, you will be able to join using the GoToMeeting link. The only change or the only difference is if the congressional office wanted to use their platform, usually for security reasons. In that case, you won't have one of our links, you'll have one of theirs or their call-in number. When you press GoToMeeting, when you press that hyperlink, if you have not already used GoToMeeting in your life, it will ask you to sign in with an ID of your choice and to choose a password. GoToMeeting is extremely simple. You will not see a lot of things to do. You cannot do a lot of things. It does work whether the staff is joining with a conference call or a webinar. So you can use that link for every single one of your meetings. And there's a couple additional things you can do, and then there's nothing else you can do but participate in your meeting. So at the top, you'll see 3 icons. One looks like 2 people. That'll tell you everybody who is on a given call or in a given webinar. There's a chat function that you should use to chat with everybody if you would like to share information during the call or webinar. Be mindful that if the staffer member joined the call or webinar using the link, that they may have access to what you say in the chat box. And there's also a gearbox, mostly used if you are looking for an alternative to computer audio and you want to get that phone number and PIN number to call in instead. That information is also provided on your mobile tool at the end of your meeting lines. Finally, a couple things to keep in mind. Take a look at the left-hand side of this slide. Please call in a little bit early. Please make yourself as flexible as possible for those practice practice sessions when your team leader reaches out. This will give you the opportunity to get all of your technology in order. If you have trouble on the day of the event, you're going to ask your team leader early for some assistance or call the Soapbox Help Desk. Background sound is always an issue with webinars and conference calls. You'll hear your team leader periodically remind you to make sure the little kitties are out of the room, make sure your pets are out of the room, make sure you mute yourself if you happen to be in your car. We're going to ask everybody to not introduce topics that are not part of our unified ask. These meetings are scheduled strictly for the people who are on the rosters to discuss the issues that you are going to discuss. Please do not bring up the election, and please do not bring up side topics. You can expect the meetings to last about 15 to 20 minutes, typical for the length of a meeting on Capitol Hill. We will send to the legislative offices a copy of the fact sheets plus a state fact sheet and any story banks we get from the state before your conversation. So that frees you to focus a little bit more on local and personal stories rather than trying to brief them on all the issues. Very important, these are not office hours and these are not town halls. So let me say that again. These are not office hours and these are not town halls. This is not an opportunity for somebody who is not registered to talk about an issue, even if it's health related, by logging into one of these meetings. If somebody ends up on one of these meetings who is not part of the roster, the team leader or the congressional staff may terminate the opportunity to talk about these issues before the election. So please do not share any call-in information. Do not share any links with your friends, with your neighbors, with people who care about other important issues. They may result in the meeting being canceled. I talked about your feedback. The final thing I will mention, or actually two final things, it sometimes takes staff a little bit of time to get into a virtual meeting room. Sometimes they fall behind with their calendars. So if the staff does not show up for a little while, have the team leader call the Soapbox Help Desk after about 10 minutes. Everybody else stay in the meeting room. We'll work on the back end trying to find the staffer member and get them into the call. If we have to reschedule, we'll let you know, and then we'll try to reschedule for the same day. So again, give them several minutes to get into the call. If after 10 minutes, you're not seeing or hearing anybody, have the team leader reach out to Soapbox. Everybody else stay put. We'll try to solve the problem at that time. You are going to be having fun, talking about these issues, hearing each other's stories, bonding with other folks who care about the same things you do, maybe seeing some folks you see every year at the Rally for Medical Research. So between meetings, sometimes people speak, and sometimes they catch up with one another. Sometimes they use it to plan out how they could do better for their next meeting. Please be mindful in these virtual spaces that you should not debrief or talk about any of the legislative offices. Please do not make jokes. Please do not be snarky in between the meetings, because people might be logging on or have not yet logged off. So that's one of those things you just want to keep in mind, but you will enjoy each other. You will talk about your stories. You will bond with each other, and we welcome you to do that. Just being mindful that people are popping on and off of these virtual meeting rooms for the upcoming meetings. With that, I'll turn it back over to Brandon. Enjoy your day. We'll talk to you during your practice sessions, and if you need further assistance on the day of the event.
Great. Thank you so much, Christopher. That's a lot of very helpful information. So we are going to stay on just for a few extra minutes. I know we've been answering as many questions as we can through the Q&A function, but I know there were some other questions that we didn't answer yet, so we'd like to take a few more of those. If I could ask Megan, Christopher, and Mary Jo if you can put your video back on so that you can all be here to help with any questions. Perfect. Okay, and then Mark, could you help us with finding some of the additional questions we can answer?
Absolutely. Hello, everybody. My name is Mark Johnson. I'm the Senior Manager of Congressional Relations for AACR. And let's go ahead and answer the questions. See, you have a lot of good questions here. First question, how do you post to a member's Facebook page? Does anybody have an idea?
Oh, can you hear me?
Maybe.
Yeah, I can hear you, Chris.
Yeah, so what you do first and foremost is you make sure you filled out your feedback form for the meeting. So the first thing you want to do is let this team know what happened in your meeting. If you do have a photo, then you want to attach the photo to your feedback form. So again, this team that's fighting together has what we need to move things forward. Beyond that, you can go on Facebook, search for the member's name, and then you could write on their wall. And if they accept, you could post your photo there as well.
Okay, thank you, Christopher. Another question, can any of the COVID federal funding be used towards medical research that is non-COVID related?
So that's a good question. I think for the purpose of our Hill Day, we're going to focus on the messages that we talked about before related to asking for the additional, an increase of $3 billion for FY 2021, and then additional supplemental funding for NIH of $15.5 billion to respond to COVID-19. The funding that was already allocated to NIH and other agencies previously was allocated specifically for COVID-19 research, and I think that is, that is likely going to be needed specifically for that purpose.
Thank you, Brendan. Next question. If I am meeting with a congressperson I am not a constituent of, should I take it, or should I be vague about where I'm from?
No, you should be honest about where you're from. They will know exactly who is to be in these meetings. They have your name, they have your address, and they know that you are part of a delegation from the state. For every meeting, there should be a constituent that is part of the group. And when you prepare your meetings, you might choose to make sure that that constituent is a little more front and center for the meetings where they are the bona fide constituent. But for all meetings, you'll be participating, you'll be sharing, you will be part of the team.
Background noise, okay, there we go. Is the ask the same regardless of whether the member serves in leadership or on the appropriations committee or not?
So I can take this one. So your group leader, depending on how the meeting is going, may tailor the message a little bit. If you're talking to a member of leadership, then the group leader may talk about how they as leadership can help in the fight. So it might be tailored, but it's also okay if you just deliver the same ask. If you get caught up and you just deliver the same ask that you give to everyone else, nothing bad is going to happen. So that's fine, but group leaders generally know when they should tailor the ask a little bit based on committee assignments or leadership.
Thank you, Megan. Where are these stories you mentioned that are due today? I don't recall seeing these unless it was something I saw and completed a long time ago. I think, Brandon, you want to address that?
Sure. So as Christopher mentioned in his presentation, this is the Story Bank feature, which is part of the Soapbox mobile tool. So you all should have received a link either last week or this week, depending on when you registered for the Hill Day, and that's from Soapbox, and that allows you to access the mobile tool. One of the options that you have in there is the Story Bank feature, and once you go in there, you'll be able to enter your story. So you don't need any extra link or any additional email or anything like that. Just use the Soapbox mobile tool.
Thank you, Brendan. Our next question. I have back-to-backs and I'm worried I will not be able to upload responses until tomorrow morning. will this be too late?
I really love that response. So thank you for being concerned about that. And no, it will not be too late.
Great. Next question. Let's see, I'm sorry. Let me go back here. Okay. I am a group leader, but not available at these times. Presumably my group can plan another time.
Yes. So if you let me know, I can make sure your meeting space is open and ready for you, or email Brandon the time that your group would like to meet, and I'll make sure your virtual space is open.
Okay. Next question. Most of my meetings are still TBD. Should I just choose the one that is physically at the top of the list?
Oh, for your meeting space, yes. Yes. I think some of the TBDs, if you look, they still should have the link. So actually still look for your first house meeting and use the link there.
Okay, thank you. Can we test GoToMeeting in advance?
Yes, during your practice sessions. So reach out via email to your group leader or answer the email that your group leader sends. And then when you go to your practice session, that will be your test and should be a good way to get your computer all ready for your meetings.
Great, great. Who is the group leader for the Senate meetings when there are multiple group leaders listed on the roster?
Very good question. So for Senate meetings, the person who is the group leader for Team 1 will take the lead on the Senate meetings. So if you are a group leader for teams 2, 3, 4, etc. in your state, you'll be the leader for your House meetings, but there will be one group leader for the Senate meetings, and that will be the person who's part of what's called Team 1 for your state. All of that information is under the icon that says My Team. You can see your team leader, you can see your group number on the mobile tool, sorry.
Thank you, Christopher. Is there a way for the Soapbox tool to send a calendar invite to Outlook?
No, because the meeting cut times can and do change up till the day of the event. So we will, on the day of the event, send you push notifications if something changes, but we won't be sending you push notifications until the day of the event. So you do have to use the mobile tool to take a peek and see, like, for example, those TBD meetings, those will come through, but they're going to come through a little bit closer to the event. So this gives you a tool that in real time will reflect your current meetings. And then you will get from Soapbox a reminder 1 hour before each meeting as it is currently scheduled.
Okay, next question. Someone mentioned that they're not on Facebook, but they're on Twitter, and they're wondering why we're not suggesting tweeting.
Oh, we absolutely suggest tweeting.
Yeah.
So we would love for you all to tweet messages leading up to and during the Hill Day and following the Hill Day. So this is an opportunity for you to share. For one thing, you can print out from the Rally Toolkit page the I Rally For sign and write on there whom or what you rally for. Take a photo and then you can post that. During the Hill Day, we do encourage you to ask permission if you are on a video call. Ask the member or the staffer if it's okay for you to take and share a screenshot. If they say yes, then you're welcome to share that screenshot as well. And then you're also welcome and encouraged to send additional messages on Twitter, both messages to your member of Congress, thanking them for the meeting, thanking them for their support, and to encourage others to join you in sending messages as well. So absolutely, please do use Twitter. Our primary hashtag is #RallyMedRes, and our secondary hashtag is #FundNIH. Mark, I think we have time for just one more question and then we'll wrap it up.
Okay, see here. Let me find a good one. Okay, here's a good one. How are we to manage when there are over 20 members assigned to that meeting with the congressman?
So that will be in the case of some of the Senate meetings, we'll have larger groups. But in the case of the Senate meetings for larger groups from a given state, everybody is invited to observe the Senate meeting, but the people who will take the lead on the presentation are the people from Team 1. So again, that group leader will be in charge from Team 1 of the Senate meeting, and the people who will share their stories and make the arguments for the Senate meetings will be the folks from Team 1. However, everybody's invited to observe the meetings, and the team leader might, time permitting, at the end, call on 1 or 2 additional people to share their stories briefly.
All right. Thank you,
Great.
Christopher. And back to you, Brandon.
All right, thank you so much, Mark. Well, I think we answered most of the questions. Apologies if we didn't get to all of them. If we didn't get to your question, you are welcome to send it to info@rallyformedicalresearch.org, or if it is a question directly related to your schedule, you can write to Soapbox. And Christopher, what would be the best email address for folks to use?
Anyone can send me an email, kush@soapboxconsulting.com. So that's kush@soapboxconsulting.com, or call us at the help desk, 202-362-5910. If you've got your mobile tool code, you can just respond to that email. We are all in the office right now, so we are ready to answer any additional questions you have.
Thanks, Christopher. And I know one of the most common questions that we got was, will we be sharing a recording of this training? And the answer is yes. So we will be sharing that recording on the Rally website, on the toolkit page. You can expect that to be up tomorrow, along with the mock meeting videos that we mentioned earlier. So thank you all so much. We're so excited that you're going to be part of the Rally for Medical Research Virtual Hill Day. We appreciate your time in joining our training today. And we look forward to seeing you virtually again at the reception and during the Hill Day. Take care, everyone.